Welcome friends. So the chemical name of moxa leaf we call Artemisia vulgaris. This is a scientific name of the moxa leaves what we use here. So moxa is used in various forms. It is to balance or the correction of the chi or the prana shakti what we discussed in previous class according to the traditional Chinese concept. So this Artemisia vulgaris is used in multiple ways. One as a direct moxibustion, another version is an indirect moxibustion. So in direct moxibustion there are two methods. One is scarring moxibustion, where the moxa cone or other forms of moxas are used on the skin directly till there is a scarring. So because of the scarring of the skin, this is not much used in nowadays modern therapies. So most commonly non-scarring method is used, where the cone of the moxa is kept on the skin and it will start burning until it near to the end. So still it is red hot, and near to the end of the burning on the skin, this moxa will be removed, so that maximum effect of the heat of the moxa cone will go to the area of the skin which is programmed to increase the yang or decrease the yin. Or permutation combination, where what you want to do, either you want to increase the yin or decrease the yang, or any of the permutation combination related to that particular disease of the body. So it has been written in various details about moxibustion. The procedure is called as moxibustion and the leaf is called as moxa, for you to remember. So I mentioned about direct moxibustion. In that, scarring and non-scarring moxibustion. So most commonly we use all the indirect moxibustion. So in this indirect moxibustion, we use the moxa on the needle. Say for example, this is a skin surface and we have put an acupuncture needle. Either we use a hot ginger here, which will act like a moxa, or we use a garlic here, which will act like a moxa, or we put a moxa cone itself on this, where the heat of this will get transmitted to the needle and then it will go inside the skin. So in this, there are some other moxa structures, or there are structure which will hold the moxa cones, various methods. There are some moxa cones which will be like this, structure like this, which has a iron bars which will not allow the moxa to fall down onto the skin and still transmit the heat of moxa to the skin. So this will be kept on the area which we are focusing, and it will be tied. So this will be tied. So required duration 15 minutes, 20 minutes it will be given. So this is a very new therapy. So in Indian continent, what we see is anything coming from the west which people wants to try, it works much better for Indians. So what I mean to say is, for Indians, if you want to try acupuncture, moxibustion, it works little better than Ayurveda, because your body is tuned for yoga and Ayurveda. So in our case, what we do, we ask you to follow your medical doctor's instructions and then take up our IMRx therapies. These are integrative medical therapies. All the medical therapies are evidence-based and cost-effective and effective in terms of the pain management with this particular IMRx therapies. It is used for various disorders. We not only use the moxa as a treatment unit or acupuncture as a treatment unit, we also use yoga, Ayurveda, acupuncture, other physical therapies, your therapeutic exercises, physiotherapy techniques, everything, whatever needed, whatever useful, best for the patient, We use this in integrative medical therapies, which is specially designed by trained medical doctors. So we use it for various pain management, disease management, cancer, neurological disorders, and various asthma, arthritis, so many diseases we use. So hope you get a clear idea. We suggest you to meet your doctor and then decide any of these therapies which you are heard from us. Okay, thank you.